Hello everyone and welcome to the channel. Today we will be discussing constipation, its causes and what steps you can take for prevention. So first of all, let's take a look at what constipation is. If you only have the urge to visit the bathroom every second or third day and struggle to pass stool, then you may suffer from constipation. Having difficulty passing stools and bowel movements can be very painful. You may have to push or strain a lot when using the bathroom. This can sometimes lead to rectal bleeding. If you have any of these symptoms, please see your doctor. If your stool is hard, dry, or abnormally small or black in color, it may also be harder to pass. When you are constipated, you may experience pain in the lower abdomen and stomach aches. You may also experience a bloated feeling in your stomach and have intermittent cramps. Not only will they affect your digestive system, but they can also make you feel bloated and cause nausea. The common reason for these symptoms is that waste has accumulated for too long and consequently begun to decay. This produces gases which accumulate in the abdominal cavity. These gases make the intestines become enlarged and obstruct the blood flow in the veins, which affects digestive function. There are some serious problems you may experience if you have a long-term constipation issue, including these systematic symptoms such as heart disease, pain, stress, and malnutrition. Constipation may also lead to hemorrhoids and even cancer. Constipation is a common problem. In North America, for example, chronic constipation affects approximately 63 million people. Approximately 12% of people worldwide suffer from self-defined constipation. To understand what causes constipation, it helps to know what happens to our food once we consume it. What groups of foods can benefit us and what steps we can take to avoid becoming constipated. It's a commonly held belief that digestion only takes place in the stomach. There are actually 3 separate stages of digestion. The first is the oral stage of digestion. Chewing food breaks it down into smaller pieces, which mix with saliva. The enzyme, amylase, present in saliva, starts the process of digesting carbs, so digestion becomes easier for your stomach. Saliva from your mouth begins to mix with the food that you've eaten. This causes a soft lump of food, called a bolus, to form and become easy to swallow. The bolus travels down through our esophagus and into our stomach, where the enzyme, pepsin, helps to break down proteins into smaller particles. Stomach acid protects the digestion process and kills any bacteria or viruses that may have been present in our food. This helps ensure we stay healthy. Stomach acid turns the bolus into chyme. The chyme moves from the stomach into the small intestine, where the remnants are exposed to digestive juices, bile, and enzymes from the pancreas and the liver. Nutrients such as carbohydrates, proteins, fats, and vitamins are then absorbed. Waste then moves through the length of the large intestine, helped along by a wave of muscular contractions. Excess water is removed from the waste before being temporarily stored in the rectum. 3/4 of fecal matter content is water. The rest is solids, including intestinal bacteria, undigested fiber, and dietary fats. The removal of the excess water in the large intestine changes the waste from a liquid to a semi-solid form. The waste then moves into the rectum, where the waste is stored until a system of nerves surrounding it sends a message to the brain that waste is present and needs to leave the body through the process of defecation. The entire process of consuming the food to the passing of stool takes anywhere between 24 to 72 hours. However, the amount of time varies depending on the amount and type of food eaten, your gender, or the presence of digestive issues such as Crohn's disease or irritable bowel syndrome. If you are constipated, the stool can be hard and dry and difficult to pass. Constipation can be caused by many factors that often work in amalgamation, including a change in routine. Regular and rhythmic contraction of the bowels contribute to having normal bowel motions. Changes in routine can often upset the body's internal clock. Shift workers and travelers often experience this type of constipation. A low-fiber diet, not drinking enough water or fluids, lack of regular movement and exercise, living a lifestyle where you don't move around much, or being limited in movement because of a disability are frequent causes of constipation. Avoiding going to the bathroom. The longer stool is held inside your body, the more water is removed from the stool, making passing of the stool more difficult. The more this urge to go to the bathroom is ignored, can cause the body to become less reactive to the standard signals to go to the bathroom. Some medications can cause constipation, including painkillers, diuretics, and medications used to treat Parkinson's disease, high blood pressure, and depression. Constipation is a very common problem during pregnancy. Almost 3/4 of all pregnant women will experience constipation or other bowel problems at some time. Constipation is more common in the elderly. With age progression, a number of factors, including reduced intestinal muscle contractions and dependence on regular medications, Illness, or a period of illness resulting in being hospitalized with bed rest, normally results in constipation. Stress can also be a contributing factor. When people are under stress, their blood pressure and heart rate increase, which can result in the body supplying more blood to vital organs, like the heart and brain, but less to digestion-related regions. In response to stress, the body releases more of the hormone corticotrophin-releasing factor in the bowels, which slows down intestinal movement. Eating too much milk and cheese. Milk and cheese have a high content of fat, and their dietary fiber content is low. The fats in these products cause the digestion process to slow down and make chances of constipation higher. Diseases such as irritable bowel syndrome can be made worse when people are exposed to high levels of solid fats. It's for this reason that it's best to consume solid foods that will result in the passing of stools without discomfort. Consuming too much refined food. Most refined products are void of fiber. During processing, the germ and bran are removed. Our bodies need these whole grain food components that are rich in fiber and add bulk to the stools, making them easy to move out of the body. Based on the information presented so far, continuing with a diet that causes constipation can cause symptoms to recur. By making changes to your diet, you are likely to prevent constipation from happening again. Increasing your fiber consumption will definitely help. Did you know that fiber can be soluble or insoluble? Insoluble fiber adds bulk to feces, making it more easily pushed along through the digestive tract. Feces with more soluble fiber can be soft. Good sources of soluble fiber include legumes like beans, peas, chickpeas, lentils, and peanuts. Fruits such as pears, bananas, prunes, apples, avocados, raspberries, blackberries, oranges, apricots, and blueberries. Vegetables like sweet potato, broccoli, Brussels sprouts, artichokes, rhubarb, green beans, cucumber, cabbage, zucchini, okra, spinach, and leafy greens. Good sources of insoluble fiber include flax seeds, chia seeds, whole grains, wheat bran, whole grain bread, brown rice, cereals, and oats. Drinking more water or fluids throughout the day is also beneficial to us. Feces with fiber will only bulk up if sufficient quantities of water is consumed. If enough water isn't consumed on a high-fiber diet, then constipation can occur. Another great idea is to keep a diary of what foods you are eating and what your bowel motions are like. This is a great way to pin down which foods are working well for you and which ones are not. I do hope the information presented to you was helpful and your dietary changes bring you relief from your symptoms. It is important to see your doctor for diagnosis and treatment of constipation. It is also important not to overtreat constipation with laxatives instead of seeing a doctor, because laxatives can lead to dehydration and more serious problems like intestinal obstruction or rectal bleeding. In general, if restoring fiber intake, exercise, or hydration still isn't solving the problem, chronic constipation may be the cause. Your treatment may depend on what caused chronic constipation in the first place. For instance, you might need physical therapy or even low-dose laxatives from your doctor. If you suffer from chronic constipation, it's important to consult with a healthcare professional. This is especially important if you have any warning signs of disease such as weight loss, bleeding or pain, or stool that are hard and lumpy. If you wish to see more informative topics like this, please let us know in the comments below. I have included links to other good sources of information relating to constipation also. Please like, comment, subscribe, and have a great day.